Q&A with a plastic surgeon. Breast augmentation and breast lift scarring.
Okay, so when we're talking about breast augmentation, breast lift, we're deciding on which procedure to do. We need to remember some basic concepts. In the breast, we have basically three variables. One is volume, one is surface area or skin, and the other one is the position of the nipple. Typically, there's an ideal relationship between how much skin and how much volume. If you have a lot of volume and a small amount of skin, we have a nice perky breast. When you have more skin than volume, we have a sagging breast. And so it all depends on the nipple position. We'd like to see a breast where the nipple is above what we call the inframammary fold. As this breast starts sagging, different degrees of sagging until eventually the nipple points down. So we have this type of progression of breast sagging. When we do an augmentation, we increase the volume and do nothing with the skin, nothing with the nipple position. We can do that in an adequately shaped breast or perhaps with a slight sagging with the nipple a little bit lower. However, there are times that we need to do the lift, and when we do the lift, we do nothing with the volume, we decrease the amount of skin, and we elevate the nipple position, basically collecting the existing volume into the smaller skin envelope. Then the more difficult procedure becomes when we combine the augmentation with the lift. In this case, we increase the volume with the augmentation, we decrease the skin, and we elevate the nipple position. Here we're changing all the variables in the breast, and we're creating an entirely new breast mound and breast shape. When we talk about lifting alone, sometimes we can do what we call a donut mastopexy, where we elevate the nipple position up here and we close the big circle with a smaller circle, ending up with a scar around the nipple. There are other cases in which we need to correct the width of the breast, and as we elevate the nipple position, ice cream cone type of incisions, we remove the skin, elevate the nipple position up here, and we wind up with a lollipop type with a vertical scar. Then there are the other situation where the breast is sagging quite a bit, and we need to elevate that nipple way up here. In these cases, we do this type of design, which is the classic anchor type incision. The nipple is way down here. We want to elevate it up here. This then goes to this type of shape, or the nipple, and then we close this with this and this with this, and we end up with our classical anchor type incision. Okay, so in summary, the degree of scarring depends on the degree of sagging. When we have, let's say, perhaps a grade 1 type of sagging, we can get away with simply the donut lift. If we have more sagging, we end up coming this way. And when we have this situation, we are now talking about a anchor type of scar.